Hi, I'm Dr. Eric, the fitness physician, and let me start this video by stating that as a physician, I see a place for physicians and healthcare professionals in the world of healing, and I personally thank God every day that we have doctors, nurses, and physicians trained at saving lives when a situation is critical. From my past experience early in my medical career working in the emergency room of a major hospital, I can tell you that whether it's traumatic injuries, sudden and unexpected health emergencies, broken bones, or raging infections, medical care is hands down the best at treating emergencies. However, conventional medicine is not the best approach when wanting to prevent, treat, and reverse chronic diseases. This means that conventional medicine is not the best approach to treating obesity, being overweight, depression, autoimmune disease, diabetes, arthritis, gut dysfunctions, or any other chronic condition. More than ever, it's important to understand conventional medicine's inherent incompetence when it comes to addressing chronic disease and prevention. This goes to social media gurus, professional stars online, etc. Despite all the advancements in medicine today, we are in the midst of the worst chronic disease epidemic in human history. Let's look at the statistics of unhealthy reality of today. So approximately 70% of Americans are overweight or obese. That's 2 out of 3. 1 billion people suffer from diabetes and obesity combined. 30% of kids between ages 2 and 19 are now obese. Obesity rates have quadrupled in the last 30 years. Even though more people are taking blood pressure medicines than ever before, 600,000 people die of heart attacks every year. 1 in 4 women and 1 in 6 men have an autoimmune disease. More than 50% of U.S. adults take prescription drugs. 40% of the elderly take more than 5 medications, and more than 90% take over-the-counter drugs daily. The number of people diagnosed with depression increases by 20% each year. These numbers don't shock you. It's because poor health and chronic disease has become so widespread that's kind of been normalized. And American health is under attack. This is the first time in modern history that our lifespans are decreasing, and unfortunately, it's almost certain that things will get worse before they get better. We currently have the first generation of kids in modern history with expected shorter lifespans than their parents. That's horrible. If you currently understand how expensive healthcare is today, imagine what the cost will be for your children. The cost of diabetes alone is $250 billion a year, and this disease is set for exponential growth worldwide and big business to the pharmaceutical industry. Put that into perspective, the World Health Organization estimates that the cost of ending world hunger, is $30 billion, a fraction of that cost. We should be reversing and preventing chronic disease while doing minimal harm, not simply treating it. And all the statistics that I mentioned show that we're doing the exact opposite. The ineffectiveness and outright danger of treatment itself is horrifying. Studies in the British Medical Journal, the Journal of American Medical Association, and Johns Hopkins all suggest that conventional medical care and treatment is the third leading cause of death. These studies have found that conventional medicines, medical errors, etc. are responsible for over 200,000 deaths, 77 billion in extra costs, 8 million hospitalizations, and 77 million extra drug prescriptions. That's a lot. I think it's safe to say that chronic disease is currently out of control, and modern medicine has no answers. But why? There are dozens of reasons why conventional medicine is failing to address chronic disease. But it all really comes down to 3 fundamental issues. The powers that be in the government want more control over people. Conventional medicine focuses on symptoms. Conventional medicine operates on the wrong paradigm for health. So while conventional medicine is great for addressing urgent matters like as infections, blunt force trauma, major accidents, etc., it's just not equipped to address chronic disease or preventing it. Conventional medicine was birthed from an era when infectious disease was the leading cause of death. Acute conditions such as appendicitis, gallbladder attacks, open wounds, and bacterial viral infections, these are the primary reasons why people looked at medicine. The treatments in these cases were pretty simple. The patient had an infection or pain, the doctor had an antibiotic or some of the pain relief medication, or they did a procedure and they treated it. The patient either got better or they died. In short, there was one problem, one doctor and one treatment. But today's healthcare problems are way more complex. The average patient doesn't go to the doctor for a simple problem. Rather, most doctor visits today involve complex imbalances in physiology and biochemistry and much, much more. Most doctor visits today consist of people who are dealing with chronic health conditions, and in some cases more than one. Unfortunately, many doctors still try to operate on this old one patient, one condition, one treatment paradigm. They don't have the time to address this. It's the system that's the problem. The paradigm of suppressing symptoms with drugs rather than addressing the root cause of a health problem is the reason why conventional medicine is failing. For example, if you go to a doctor with high blood pressure or high cholesterol, you'll be given a drug to lower it. Worse, you'll be expected to take this medication for the rest of your life and no clear path as to why this condition developed in the first place. It'll ever be brought up. It's clear that this approach is not the best way to prevent or reverse chronic disease. Recent statistics suggest that more than 85% of chronic disease is caused by environmental factors such as diet, behavior, environmental toxins, and lifestyle. But how many times will a doctor take the time to investigate a patient's diet, health behaviors, toxicity load, stress, and lifestyle? They almost never do, and when they do, they simply say things like, you should eat better and exercise more. This is where root cause cellular medicine comes in. If we want to prevent and reverse chronic disease, we need a medical paradigm that operates on a foundation of focusing on reversing the root cause of disease rather than simply suppressing symptoms, recognizing that there's a strong mismatch between our genes, behavior, environment, and the combination of these factors is what contributes to the development of chronic disease. Conventional medicine is kind of outdated in this delivery, and it's the system. The current model of healthcare delivery is outdated given the fact that chronic disease is complex and requires deep investigation into the underlying causes. The current conventional model of 10 to 15-minute visits is inappropriate. The second reason why conventional medicine is failing at addressing chronic disease is because the model of delivery is outdated. The primary cause of chronic health conditions involve, again, a combination of genetics, lifestyle, behavior patterns, and the environment, and much more. We're not suffering due to bad genes or bad luck. We're suffering from the wrong choices about diet, physical activity, sleep, stress management, and so much more. It's very complex, especially nowadays. In this case, the conventional medical model is not set up to address such complex factors that contribute to ill health. With the average patient visit with the primary care provider, again, lasting maybe 10-15 minutes, how could we expect any long-lasting change to occur? If a patient has multiple conditions on several medications and presents with new symptoms, it's nearly impossible to provide adequate care within that short 15-minute window. There's barely enough time during a visit to review the current set of medications and symptoms, much less have a very necessary and detailed discussion of diet and lifestyle factors, etc., that are contributing to their problem. The reality is, patients need a lot more support in order to make long-lasting changes than simply being told they should eat healthy and exercise more. To truly address the chronic disease we're suffering from, we need a completely different model of care. This is called cellular medicine. The cellular medicine model consists of an assessment, so interactions between the doctor, healthcare provider, and patients that last longer than 50 minutes. Again, this type of interaction, this is different from that. This type of interaction allows for a more detailed intake and history for the patient, allows for the proper review and updates of current treatments and new symptoms. Finally, there's enough time to do detailed discussion about lifestyle, diet changes, and any other necessary coaching the patient may need to properly execute the recommendations. So the emphasis is on collaborative care. Okay, in this manner, the doctor will work with the patient as a partner, not a dictator, right? This is completely different from the expert model of care where the doctor is the doctor and you are the patient, right? Patients should be allowed to take an active role in their health. And when they ask for certain tests or procedures, the doctor shouldn't immediately deny or object it. They can have that discussion about it. We're going to combine high tech with high touch by utilizing advanced lab diagnostics and improvement in communication technology. Modern healthcare practices can streamline and automate outdated methods of doctor-patient interactions, which reduces overhead reduces costs, and improves quality of care. Cellular medicine is the future of healthcare. The good news for patients and those suffering from chronic disease is that a better model of cellular medicine healthcare delivery is already available. So, if you're suffering from a chronic health condition and you feel that there's something missing that conventional medicine has missed, and if conventional medicine is failing and you want something different, consider working with a cellular medicine practitioner like myself or one of my colleagues. You have questions about hormone optimization or losing weight or cellular medicine in general, contact us for more information about our cellular medicine approach. This is the way to better health, weight loss, and hormone optimization called Primex Cellular Health. Make an appointment with me, Dr. Eric, today. The first step is to schedule that initial consultation today. So contact me at 740-777-9717 or email me directly at eric@drericvate.com. That's DRERICFETE. Be sure to visit my website, drericprimex.com, and check out all my social media pages for more great content, products, and services. Thank you, and live Prime.